Also today, our resident eye doctor Neil Sharma will be in to take your calls. We had some alarming new medical evidence revealed this week about the shocking impact computer and smartphone use was having on our eyes, particularly young eyes, and it's a worry. And we'll talk about treating cataracts as well. But if you've got a question for Neil Sharma, he'll be in just after 1. I'll have another extraordinary... This week, it's been revealed that more than ever before, the dangers of the time we spend on our smartphones and tablets are doing us a great deal of harm. And it's a real worry for our younger generation coming through. And we've already discussed today the impact of being distracted on devices while you're driving a car. Well, this is related. The addiction some people have to their devices and what it's doing to your eyes. Because the latest figure shows that staring at tablets, smartphones and computers is making children half blind, with the number of short-sighted children almost doubling in the past 5 years. Now, there is a clear correlation that in the last 5 years, more of our children have been addicted to their devices. Children are spending more time on smaller screens in particular, closer to their faces, and it's putting more strain on their eyes, which means they're not used to seeing long distances, and this results in them becoming short-sighted. Good at short distances, but not long distances. Now, doctors are warning parents to limit children's screen time and send them outside for at least 90 minutes a day to get exposure to natural light. So it's a two-pronged problem. Let's get the expert opinion on all of this. And we've had him in the studio before. If you'd like to speak with Dr. Neil Sharma on eye health, you can go right ahead. Right now, 131-873. He's ready to take your calls. Neil's from Eye and Retina Specialists, which is located in Green Square. He joins me in the studio. Neil Sharma, thank you very much for coming in once again.
Good afternoon, Chris. Thanks for having me again.
As dads, we know how addicted they can be at times, our children, and the problem is they're such a small screen, aren't they?
Exactly right. I mean, I've got 2 young kids myself, and they love being able to control the small device and hold it and watch YouTube and videos and so forth. But if you're not careful, they can spend a long time on it, and getting them off can be, a serious problem. So it is something that I think increasing attention is being paid to and being recognised, and especially with short-sightedness, as children are looking at a screen at a very close distance, that is going to impact on their developing and growing eye in a negative way.
And they can be locked on to that site, especially if they're following a particular thread through a social media platform. They can be locked onto that site for hours.
That is correct. And again, it's well known if you're looking at a screen, you're blinking less often, you're getting dry eyes and other sort of glare problems and so forth. So it can impact on a variety of ways, and trying to disengage and encourage children and even adults to get outside or take a break, go for a little walk around and so forth. Anything to try and break that cycle of spending too long in one go.
Very, very true. If you've got a question for Neil Sharma, 131-873. Jem, go right ahead. Neil is listening.
G'day, Neil. G'day, Chris.
Hi.
Mate, I was just listening to before, as you were saying, we've got to get the kids into, the natural environment outside. Now, for that very reason, I got them an Opal card so they can travel to and from school using public transport. They're in the middle of high school, sort of around the year 8, 9 mark.
Yeah.
The only problem with that is, mate, that they're on their devices when they're walking to and from school, Can't win, mate.
You can't win. See, you've done the right thing. You've tried to get them in an outdoor environment, as Neil was saying, but if they're going to be on their devices, you've defeated the purpose.
Yeah, that's right. Now, I mean, it brings up a security issue too, Chris. Like, someone could run up behind them, and it's like, the devices are about, close to $1,000 each.
Yeah.
It could open up a whole raft of issues, and then probably have to get them, driven to school.
And safety issues, I'm with you. Yeah, all right, Jem, thank you very much for that. 131-873. It's a worrying statistic to learn that the number of short-sighted children has almost doubled in 5 years. Now, we can only say that there's correlation with screen time, but I think it might be a little bit worse than that. Would you agree?
That is true. I mean, it's been known for quite some time that children who spend a lot of time with near work, and in the past, generation ago, a lot of book work or close activities did have higher rates of myopia or short-sightedness already. And there are genetic and other factors as well.
Yeah.
But this generation, from the age of 1.5, 2 years old sometimes, spending a long time looking at a small screen is going to cause problems more than likely as they get older.
Okay, 131873. Julie, go right ahead. Neil Sharma is listening.
Hi Neil, how are you?
Good, thank you. How are you, Julie?
Good. I've been diagnosed with multiple sclerosis about 15 years ago, and actually affected my eye. So I've got lesions in my brain. My eyesight become blurry. Since then, I've been fine with medication. A couple of years ago, my eyes started to play up again, maybe because of the heat and things like that. So I did see a couple of specialists, one at the Sydney Eye Institute and another one at Liverpool, which actually done a laser to unblock my ducts, but they said my vision won't get any better. Is that correct, or is there anything new on the market that may help?
Generally, patients with multiple sclerosis can have vision problems affecting the optic nerve or the visual pathways in the brain itself. Often, the treatment for that is treating the underlying multiple sclerosis itself. And unfortunately, vision problems or loss of vision in one eye, what we call optic neuritis, is the first presentation of a patient who then goes on to be diagnosed with multiple sclerosis.
Yeah, that's actually what I've got, and I'm on Avanex for, so it doesn't increase.
Mm-hmm.
I just didn't know if there was anything new on the market that maybe is underlying.
There are a range of multiple sclerosis therapies that are being developed, and they've certainly improved over the last 5 or 10 years and even the last couple of years compared to previously. So I'd recommend talking to your neurologist or whoever is managing the multiple sclerosis, because generally managing that is the key to managing the impact on the eye itself.
Okay. All right. Thanks for your help today.
Thank you, Julie. Appreciate that. Norma, go right ahead.
Doctor, my eyes keep locking, and a couple of days there that I've been banging into everything. They just lock and I can't see a thing.
When you say locking, do you mean you lose vision in the eyes temporarily? Or
lose complete vision, and the doctor thinks it's from Parkinson's disease, but I'm on Madapar, but sometimes they seem to help, but sometimes they don't. I'm just stuck in this house blind.
Right. No, it sounds like you need to get it sort of looked at. It would be unusual to temporarily lose vision in both eyes all of a sudden for a short period of time. So I'd certainly encourage you to sort of get it looked into a little bit further.
He put me on to a specialist, but I've got to wait till that. But it's hard trying to get around the house when you can't see at all.
Yeah, no, I can understand. I mean, it might even be worth getting someone taking you to a nearby hospital to have it looked at, because if you might need a CT scan or something a little bit more urgently, I would have thought. So please don't leave it too long, because I am a little bit concerned whenever someone, especially an elderly person, tells me they're losing vision. It could be a number of fairly acute problems and needs to be looked at sooner rather than later. So.
All right, Norma, thank you. Maybe a specialist is in order. All right, well, we're with Dr. Neil Sharma from Eye and Retina Specialists. You can go to the website eyeandretina.com.au. There's a phone number, 9699 0001, a Sydney number, 9699 0001. We'll come back and we're raising the issue of cataracts. And if you've got further questions for Neil, 131 873. Extraordinary job coming up.